When we're doing the wrist and the hand evaluation history stuff, okay, it's going to be pretty much the same stuff that we've been doing. Your mechanism of injury. So what happened? Was it direct, indirect, or overuse? Remember, a lot of times with the wrist and the hand and the fingers, you're either going to have the acute trauma of it being smashed or a laceration, something of that nature, or it's going to be overuse, where you're going to have more of the ulnar nerve, radial nerve, going to have more of those radiating type pains coming down into the wrist and the hand. Date of injury, finding out, when did it happen? Our PQRST, so finding out what their primary complaint was, what their quality of pain is. Is it, dull, achy, sharp, numb, tingling, burning, any of those kind of characteristics you want to find out. That's going to help you determine what's going on there. What causes relief? Does any positioning, posturing help? Do they find that it hurts them at night more than it does during the daytime, early in the morning versus late at night? Finding all of those pieces is really going to help with your evaluation. The severity, your scale of 1 to 10, make sure you're figuring that out. And then any times, again, that you do kind of have that relief, when it's the worst, when it's the best, those are going to help you in your diagnosis as well. Unusual sounds and sensations, so clicking can be an indication of tendons snapping over bony prominences. Any type of snapping could be the same thing. And then if we have any crepitus, or if you're noticing crepitus, we want to look into that, determine if there is a lunate issue, dislocation, if it's a fracture, if it's a false joint, before we're putting things back together. Pain, numbness, and tingling. Really, this is important. Knowing the distribution pattern of your nerves so that you can determine, when they say the back of my hand's numb, you know right away what nerve that is, you know where to be testing, you know to check the motor as well as the sensory patterns for those. So those are going to be really important for you to know and pay attention to. Disability, did they have an immediate disability or was it delayed over time? The sleep sign is going to be kind of important in these evaluations as well. I know I've mentioned it several times before. You have that extreme elbow flexion, whether you sleep like that, whether you like to sleep all curled up, or people on their phones all the time. If you're sitting on the couch or in bed, at night or in the morning, you have that extreme elbow flexion causing issues to not only the ulnar nerve, but potentially the median nerve as well. So finding out what they're doing. When it comes to the wrist, that carpal tunnel syndrome for some reason seems to flare up at night a lot. So you're going to have people that are going to be woken up by that pain, where you may need to, ask them if they have splints or if they have something to help with that pain. Technique changes, just asking what's different. If this is a sports-related thing, finding out if maybe their biomechanics are bad or they had to change their biomechanics. If it's occupation related, were they used to doing one thing and now all of a sudden they're doing something different? All that stuff can impact your evaluation. The last thing in our history that we need to talk about is going to be our training changes. So, has the mode changed? Are you doing something different? The intensity. A lot of times you'll see this when, kids just come back into their season, or if they were off for a couple of months or a couple weeks rather, and then they had to come in full force, 2-a-day practices or whatever. The frequency and the duration as well. And then I always like to tie in diet with that as well, because if they're not nourishing their body, if they're not getting the right rest, that's going to dictate and impact how their body is responding to the stresses they have.